The psychosocial risk assessment and management framework is an all-hazards approach to planning for emergency situations. It identifies 4 elements: the situation, the population, the effects, and the interventions. Now let's examine how these 4 elements interact with one another. The yellow diamond represents the situation. It includes the nature of the hazard, its vector and agents, speed of onset, number of casualties. Established treatment and prevention protocols are all examples of characteristics of the situation. Time is represented as a triangle embedded in the situation. It is connected to the situation because it evolves and constantly needs to be reassessed. The event timeline is divided into 8 phases, ranging from -3 to +3. -3, the phase currently being displayed, is the pre-event phase. 0 is impact phase, and +3 is the reconstruction phase. Time phases are situation-specific and fade in and out of each other. They do not have discrete start or stop points. Red spheres represent the psychosocial effects of an extreme event. These effects can either be normal or abnormal. Normal psychosocial effects include common reactions to extreme events. Abnormal effects also exist, such as major depression and post-traumatic stress disorder. The population is made of communities, represented here as a number of blue pentagons. These communities are socially, economically, and geographically diverse. There are subgroups within these communities which are put at less or greater risk of negative effects due to their background, age, and experience. Here we are at time 0, impact phase. Psychosocial effects can interact with the population at any point in time. However, there is a large amount of interaction during the impact phase. Notice that some communities are tilted slightly to begin with, which means they are more easily knocked down by negative psychosocial effects. Other communities are connected to one another and can prop each other up. They provide social support, and effects simply bounce off. Notice that a single psychosocial effect can interact with many communities. Interventions, shown here as green rectangles, prevent negative outcomes, enhance coping, or minimize exposure to negative effects. Interventions include risk communication, education, social support, and professional counseling. Multiple interventions are sometimes needed to right a community. At times, one intervention can be enough to right many communities. If a community is resilient enough, it can right itself. Interventions in communities interact with one another. The characteristics of a community or subgroup will affect the type of intervention and how it is carried out. Interventions can also change the characteristics of a community. Now we are at time +3, the reconstruction phase. Communities have been righted. If the interventions are carried out effectively, the communities are better able to cope with future events. They have grown more interconnected, increasing both their capacity to resist and their ability to adapt.